What's up everyone, I hope you're all having a great day. James Kearsley just here in my hospital room. Day 3 of my chemotherapy. You can actually see the chemotherapy going into me right now via this machine into my port. So I just thought I'd take this opportunity to talk about something. I've been raving on about it for the amount of months on my social media stuff, but I've never actually really talked about it. And it's the fact that why do I actually even need a bone marrow transplant? So in this video I'm going to talk to you about a bit of a brief history of the treatment, the relapse, and what the whole reasoning behind why I need a bone marrow transplant and what the hope of doing so is going to achieve. So very brief outline is, obviously I was first diagnosed in February 2014. I underwent 3 to 4 months of chemotherapy treatment in 2014 and I was in remission in June. I finished my treatment in June 2014 and was placed into full remission then. Throughout the whole next year, throughout a year after that, I went back to the gym, did everything like that. I was preparing for my bodybuilding competition, having blood tests when I first got into remission, every 2 weeks, and then as the months progressed, probably every 1 month to every 3 months. With leukemia, my leukemia is acute myeloid leukemia. In saying that acute, I believe, means that it is rather fast developing, as is, for example, when I was re-diagnosed in December, they said that my body had leukemia for about 2 to 3 or 4 weeks prior to re-diagnosis. And at that stage, my body was already experiencing quite a lot of the side effects I had previously had, such as loss of breath, lack of energy, fast heart rate, and easing of bruising as well. So the reason my leukemia is different to some other ones, I believe that younger people do get leukemia more frequent than older people, and as you are younger, the leukemia may be a bit more severe. As for myself, my leukemia was rather fast developing, which is why chemotherapy, and rather intensive chemotherapy, was required from the get-go. Over 2014, during my treatment, I met with bone marrow transplant people from up here in Melbourne, who just went through all the proceedings with me as to what would happen if I did need to undergo a bone marrow transplant, which is now the case. So here we are, I'm day 3 of my treatment and I'm set to get my bone marrow transplant in about, I believe, 7 to 10 days time. But why do I need one? The reason being is I was first put back into remission in 2014 in June. I spent about a year and a half in remission and then I was re-diagnosed in December 2015. And the reason I need a bone marrow transplant is because I can't just keep having chemotherapy and get put back into remission. Once the leukemia comes back, and since mine came back in a rather short amount of time, being less than 2 years, it means that it's going to come back again and again and again. So theoretically, if I was to just have chemotherapy here, no bone marrow transplant, my leukemia would come back. And each time I have my chemotherapy, it's going to come back faster and maybe even more severe. So a bone marrow transplant is kind of the last ditch attempt of trying to not cure the person, however, just to, I suppose cure would be the correct word of putting it. So how it works is, you can test your family for a DNA match. It runs throughout your DNA, not your blood type. So you can test your DNA via a blood test. So none of my extended family matched, so I'm getting what's known as an allogenic bone marrow transplant, which means that the donor is completely unrelated which is why I've had to find someone on the bone marrow registry. The bone marrow registry is worldwide. Basically, you have your blood tests and your DNA goes into a registry of a whole amount of people, and people like myself whose families aren't compatible with your bone marrow, they go into this lottery as such of people's DNA, and from that lottery we find the best match for a patient such as myself to have a transplant. So we have got an allogenic transplant donor from over in America who is currently in preparation for donating. And what the donating process is, a lot of people would think it is a quite invasive process, similar to what a bone marrow biopsy would be, like I filmed in my previous videos. However, what it is simply through the vein, like a blood donation, vein in the arm, the blood comes out, it goes into a centrifuge, which is a machine that spins the blood around and separates the particles of what's necessary. So what's taken out is the blood stem cells, which just go into a bag, and all the unnecessary blood cells are put back into the donor, like the red blood cells. I don't need anything like that. And the donor just goes away. In preparation for donating, they take these needles, these injections, like I've had in my chemotherapy workup to recover my white blood cells. That's just so they can stimulate enough cell production to give a good donation. From that, a person from this hospital goes over to where they are, gets the donation. It's basically handcuffed. It's not literally, but it's basically handcuffed to their hand, and it can't leave their sight until it enters my body, which is set to happen in about 7 weeks. After the chemotherapy is finished, in about a week's time, I'm having the bone marrow transplant, and that's when some of the things relevant to luck occur. There's quite a common disease that occurs due to bone marrow transplants, known as graft versus host disease. What happens with that is, due to the chemotherapy and immunosuppressant drugs that I'm going to be receiving soon, my whole immune system is gone, and the new blood stem cells that I'm receiving via my port here, they find their way to the bone marrow, where the bone marrow should be, such as inside the hip bones and the femur bone, and they begin to churn and start working and growing their own immunity in my body. If the donor is a different blood type to myself, I could receive a new blood type. Currently I'm A positive, however the donor themselves is also A positive, so I'm staying A positive and I'm not getting a new blood type. So once the cells are in there, they're working their new immune system. Graft versus host disease is when the donor's immune system recognizes my body as a threat, much like any immune system would, and because it thinks that my body's a threat, it begins to attack it. So 60% of bone marrow transplant recipients do experience graft versus host disease, and the symptoms and the things that follow can be rather small things, like a rash in the arm or just some sort of skin or irritation, and the severity can increase to being quite fatal as well. So that's really the main thing we're looking at now after the bone marrow transplant, is really trying to monitor the new immune system and keep it at bay with the immunosuppressant drugs I'm receiving, just to make sure that it is building a new immune system, however it is not attacking my own body. And from there, that's when the whole recovery takes, because it's a whole new immune system. To put it into perspective, I'm going to be up here in Melbourne for 3 months recovering. They don't keep me here for no reason. It's going to take about 3 months for me to actually recover from this procedure. which you will see all of the progress and I guess vlog style videos coming up as I continue along. However, I just thought I'd make this video just to explain as to why I need one, how it all works, and what the potential risks of it can be. However, at this stage, I'm day 3 into my chemotherapy. I'm feeling very good. The doctors are saying that I look rather well and very healthy for my preparation. All the work in the gym did pay off, of course, and I'm looking forward to being able to look back on this video and refer to someone else who may be going back through this sort of stuff, and hopefully give them a bit of hope and education as to how they can tackle their own bone marrow transplant. But thank you so much for watching, and I hope you did find something educational about this. If you have any questions, drop them down below and I'll do my best to answer them. And if you haven't already subscribed for more, I would love for you to follow this journey and just show some love to all the other people in their own situations as well. So once again, thank you so much for watching. Have a great day.